Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita. Ron is not going to be with us today.
He's off on a beach drinking out of a coconut. And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX.
Today, we will be talking about long COVID, also known as PCC. This is so much fun after dental surgery. Post-COVID conditions.
That's right, Jean. The CDC says that PCC can include a wide range of ongoing health problems that can last weeks, months, or years.
No.
Yes. Although most PCC cases are found in people who have had severe COVID-19 illness, even people that had mild symptoms or no symptoms can be affected long term.
I read that people who were not vaccinated and became infected may also be at a higher risk of having long COVID or PCC.
Yes, I read that too on the CDC's page dedicated to this topic.
Yep.
So being vaccinated and boosted may help avoid long-term effects. And since there is no test to diagnose post-COVID conditions, it is difficult for healthcare providers to recognize post-COVID conditions, or PCC. Your healthcare provider considers a diagnosis of post-COVID conditions, or PCC, or long COVID. What should we call it?
The sick that everyone has?
No, let's call it long COVID.
Okay.
I'll forget about that in a minute.
All right.
Based on your health history, including if you have had a diagnosis of COVID-19, either by a positive test or by symptoms or exposure, as well as doing a health examination.
And what symptoms do most people have if they've had PCC or long COVID? And what symptoms are associated with that?
All right. Again, resorting to the CDC for guidance.
Okay.
People who experience post-COVID conditions most commonly report tiredness or fatigue that interferes with their daily life. Symptoms that get worse after physical or mental effort, also known as post-exertional malaise. I like that. Post-exertional. I'm sorry, I can't do the dishes. I have post-exertional malaise.
Yeah, no, not going to get away with that one.
They also may have fever. Respiratory symptoms could include difficulty breathing or shortness of breath, a cough, chest pain, a fast beating or pounding heart known as heart palpitations. They could also have neurological symptoms like difficulty thinking or concentrating, sometimes referred to as brain fog. Oh, well, we'll never know if we've got that because we already have that.
Yep.
Headache, sleep problems, dizziness when you stand up, which is lightheadedness, pins and needle feelings. These are all neurological symptoms that you might have. Change in smell or taste, depression or anxiety. You could also have digestive symptoms, such as diarrhea or stomach pain. Other symptoms that you might have with long COVID are joint or muscle pain, a rash, changes in your menstrual cycle if you're a female. And some people, especially those who have had severe COVID-19 experience, multi-organ effects or autoimmune conditions with symptoms lasting weeks or months after COVID-19 illness. Multi-organ effects can involve many body systems, including the heart, lung, kidney, skin, and brain. As a result of these effects, people who have had COVID-19 may be more likely to develop new health conditions such as diabetes, heart disease, heart conditions, or neurological conditions, compared with people who have not had COVID-19. So it makes you more susceptible to get those in the future. And like we have said, some people may be more at risk for developing long COVID.
It kind of sounds like we're blaming COVID for everything.
Well, it's just that COVID is making you more susceptible to have these problems.
Okay. And the CDC emphasizes that especially those who have had a severe case of COVID-19 experience multi-organ effects or autoimmune conditions with symptoms lasting weeks or months after COVID-19, after they've had the illness. They're mostly the ones that are at, they're at higher risk. And multi-organ effects can involve, as we said, many body symptoms. We've mentioned those. And we said that, you can also have additional conditions that you didn't have prior to this. I would say, though, that a loss of smell would really do me in.
Would it?
Yeah, I'd hate to lose my sense of smell.
I thought you hate smelling because when you get a migraine, your smell is like on overdrive and it makes you nauseous.
That is true. Okay. So I'm conflicted.
Okay.
But I will say that I already have most of the other things. So, I mean,
yeah. You're not
bring on the COVID.
You're not going to know it. No, don't say
okay.
that.
I'm sorry. Okay. What are some suggestions on how patients can deal with the effects of long COVID?
Well, living with a post-COVID condition or long COVID can be hard, especially when there are no immediate answers or solutions. I mean, they're just discovering all these things as we're reporting this.
Right.
I feel like I'm a reporter. However,
we need like a teletype.
Yeah. Can we have a teletype in the background?
And now everybody's asking themselves, what the hell is a teletype?
However, people experiencing post-COVID conditions or long COVID can seek care from a healthcare provider to come up with a personal medical management plan that can help improve their symptoms and quality of life.
That sounds like it would be good for anybody. And what should someone do before going to their healthcare provider if they suspect that they do have long COVID?
Well, the CDC has a whole page dedicated to patient prep, but the key points that we're going to give you right now are write down your history. Prepare a brief history that summarizes your experience with COVID-19 and post-COVID conditions. For example, write down a list of the symptoms that you think started after your COVID-19 infection, the date of the onset of the original illness and or positive COVID test, if known. Write down when the post-COVID condition or long COVID symptoms started, a list of prior treatments and diagnostic tests related to your post-COVID symptoms, if you have any, blood work, x-rays, things like that. Anything that makes your symptoms worse, write those down.
Okay.
You know why we're going through these?
No.
Because when you go to the doctor's office, how much screen time do you get with the doctor nowadays?
Screen time? Is it a televisit?
Yeah, sometimes.
Okay. 15 minutes?
At the most.
Yeah. So, I mean, this is what we've said before, that you should bring with you anytime you go to the doctor.
Right. Have a list.
Yep. Be prepared.
Okay. Other things that you want to bring on this list are how did the symptoms affect your activities, including challenges that affect daily living, working, attending school, etc. So if you used to, like Trevor, be a runner, and now you're having difficulty running, maybe it's long COVID. How often do the symptoms occur? How you have been feeling overall. Like just an example of how you've been feeling. Tired.
Right. General malaise.
Right. Try to describe examples of your best and worst days. Select the most important issues, sometimes referred to as your chief complaints, and write them down. Also, prepare a list of medications and supplements you are taking. Most healthcare providers will ask you to provide this information with each appointment, so bringing that list with you will help keep track. Consider discussing your appointment with a trusted family member or friend immediately before and after you see your healthcare provider.
And you might want to bring them with you.
You might.
Okay.
This person can help you take notes and remember what was discussed at the appointment while it's still fresh in your mind. If your healthcare provider's office policy allows it, consider bringing them to your appointment with you.
Sure.
The provider that you meet could be your doctor, a nurse practitioner, a physician's assistant, or other healthcare professional, and it may take more than one appointment to evaluate long COVID symptoms and determine an accurate diagnosis to better manage and treat your symptoms. Your provider may ask questions about your medical history besides the COVID part. Like, did you have a heart problem before?
Mm-hmm.
Did you have a breathing problem before?
Mm-hmm.
What are your current symptoms? What's your quality of life? Depending on your symptoms, they may run tests to determine a diagnosis and a plan for treatment.
Mm-hmm.
Healthcare providers are still learning about post-COVID conditions. The CDC continues to work to determine how common these long-term effects are, who is more likely to get them, and how long the symptoms will typically last. Whether the symptoms eventually resolve or not, they're just finding these things out.
Right.
And not to open a new can of worms, but hasn't long COVID also been connected with the parasympathetic and sympathetic or PNS dysfunction?
Yes, but you're right on both accounts, and we don't have time for that aspect of this disease. So let's save that for a new episode and wrap up for today.
All right, so we're going to do...
I'm exhausted just going through this.
Okay, so we're going to do long COVID and parasympathetic and sympathetic dysfunction next.
Mm-hmm.
Okay, got it. Well, if our listeners have any questions or comments related to today's show, they can contact us at PodcastDX@yahoo.com, through our website, PodcastDX.com, on Facebook, Twitter, Pinterest, Instagram, or TikTok.
Okay. And if you have a moment to spare, please give us a 5-star review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.